been told, good news, your labs are normal, but you're still exhausted, your hair's thinning, you're struggling to lose weight, and you just don't feel like yourself. Here's what every woman should know. Normal doesn't always explain how you're feeling. Most lab tests are designed to detect disease. They're not always designed to explain why you don't feel your best, which is why your lab results should always be interpreted alongside your symptoms and medical history. The first lab test is ferritin. Ferritin measures your body's iron stores. You can have a high hemoglobin and still have low iron stores that contribute to fatigue, hair shedding, brain fog, and poor exercise tolerance. This isn't a test that's checked on everyone, but if you're experiencing symptoms like fatigue, hair loss, or heavy periods, it's worth discussing with your healthcare provider. The second lab test to know is your hemoglobin A1c. Most people think this only matters if you have diabetes. It doesn't though. Your A1c shows how your body has been handling blood sugar over the past 3 months. If it's starting to trend upwards, you have an opportunity to make lifestyle changes before diabetes develops. That may include improving your nutrition, building muscle, increasing physical activity, and losing excess weight. For some people who meet the appropriate medical criteria, it may also be the beginning of a conversation about medications such as GLP-1s. The third lab test to know is your lipid panel. Don't just look at your total cholesterol. Your LDL, HDL, and triglycerides each provide important information about your cardiovascular health. The fourth lab test to know is TSH. Your thyroid plays a major role in your energy, metabolism, mood, and even your hair. If something feels off, this is an important conversation to have with your healthcare provider. And finally, the last lab test to know is vitamin D. Vitamin D is important for your bone health, muscle function, and immune health. Low levels are common, and if you're at risk for deficiency or have certain symptoms, talk with your healthcare provider about whether testing it is appropriate for you. I'm not sitting here telling you to diagnose yourself. I'm telling you to understand your health well enough to ask better questions, because your lab work isn't just a report card, it's a roadmap. The better you understand it, the better equipped you'll be to make informed decisions about your health with your healthcare provider. Which lab test have you always been confused about? Let me know in the comments below, and I'll make sure to cover it.